Right now, there is only one cancer with a dropping survival rate in this country, according to the American Cancer Society, and that is uterine cancer. It's a disease that will kill 13,250 women in the U.S. this year. And the scariest part is we don't fully understand why. Joining me now, Dr. Vin Gupta, pulmonologist, global health policy expert, and MSNBC medical contributor. I saw this morning, and there's so many strides being made on most cancers, and this one, not so much. What do we know about uterine cancer and what's going on?
Well, Chris, one of the challenges is we don't have a great way to screen for this. There's some cancers like breast cancer, colorectal cancer. We have clear screening tools, guidelines that people know and embrace and can adopt. With uterine cancer, often we detect it late, and especially if folks don't have an obstetrician or a primary care doc. And as a result, what we're seeing here, especially Black women, is that they are presenting late to care. They don't know that necessarily irregular menstrual bleeding might be actually heralding a problem. So this lack of screening is really driving this, as are increasing risk factors.
In fact, Black women are twice as likely, nearly twice as likely to die from uterine cancer as white women are. You talked about early detection. There's just so much disparity based on whether you're a person of color or whether you're a white person in this country. What do we do in a case like this where we know, in this instance, twice as many Black women are dying?
Well, we have to fundamentally build awareness, just with many things in public health, but this is a key piece here. To your point in the setup, the one cancer that's actually increasing in rates of death, especially in minority groups, what we need to really key in on is the fact that obesity, that diabetes, that those are increasing and are the primary risk factor for increases in uterine deaths amongst these cohorts. That's critical, building that awareness. As we start to tackle that problem, hopefully risks for the onset of uterine cancer start to decline. Also critically, we're seeing hair straighteners, Chris, a key risk factor for uterine cancer. And now the FDA in July is hopefully going to intervene and say formaldehyde, a key component of hair straighteners, needs to be banned. So we're building that awareness. If you're watching this right now, irregular menstrual bleeding, key that you see a primary care provider, if you have an obstetrician, gynecologist, to have that conversation. Critically also family history. If there is a family history, you must bring that to the attention of your provider.
There was another statistic in the news this morning that really caught my eye. 55% of mental health appointments are being conducted remotely rather than in person. And we all know that we went to remote right during the pandemic, but it also added to people's stress, their feelings of isolation, their depression. And the question this raised for me is, if you want to help people who are feeling isolated and depressed, is the way to do that on a Zoom call?
Well, there's a tension here because access to mental health providers as this epidemic continues is by definition constrained. What we're seeing here is that this is partly solving the problem. At least there's early diagnosis, potentially a gateway to some therapy. But you're right, in person is always better. We just don't have enough providers. Here's the complication. We're seeing that the majority of these services are provided in the virtual space. The problem now is, as we get further and further away from the worst of the pandemic, the ability for a mental health provider in California to provide cross-state mental health services to, say, patients in Florida, that's being constrained. 30 states do not allow for out-of-state practice of virtual mental health services. That's a problem here. So even though we're seeing this traction, this residual impact of the pandemic, I think allowing for critical care, even though it's suboptimal, now we're seeing policies that are going to get in the way of that. We really need to focus in on that.